Love it. Love the calls. You should see the YouTube. It's so cool. All right. So a couple months back, many of my callers, Kimberly, I'll get right with you, but this is something important. Waterbury Hospital, you're on hold, and I hope you were listening. David,
Yes,
this is
Mike.
Michael Regan. How are you?
Great. How you doing?
Good. All right. Let me give you a little background because we just plugged a commercial. Hope you were listening online. Did you hear your commercial?
Yeah, I heard a good portion of it.
Yeah, good. So we believe in the hospital. All right, let me give you a little background. About 2 months ago, late February, we were having callers calling the radio show and saying, hey, I went to one of your seminars. I bought the Anthem product. How come I can't use my hospital, Waterbury Hospital? And we said, no, you can. So what happened was they were just in contract negotiations, and we are very proud to say, yes, Anthem Blue Cross Blue Shield is in the network. I'm going to turn the phone over to David. David is with Waterbury Hospital. David, make sure my listeners know who you are, what your great title is, and talk about the contract negotiations and that you are, in fact, a participating provider.
Oh, absolutely. Yeah, my name's Dave McDonald. I'm Vice President at Waterbury Hospital. I oversee a lot of the physician groups as well as the contracting areas as it relates to specifically this issue that some of your callers might have had some challenges with.
Yes, not many, but a few people were told that their plan wasn't in network. So touch on that.
Yeah, absolutely. And like you said, back in February was when this thing was finalized. I think it was February 15th, 2012. So in doing a little bit of research, we are definitely in-network, a power provider for any of the Medicare Advantage plans, and there's multiple different names on there. So there was a little bit of confusion in working with Blue Cross to get those uploaded into the system because we had already been taking HMO products, but the PPO products came on. So when we worked and resolved that issue through Anthem, and we've been seeing all sorts of our patients, mutual patients, through that time period have billed for them, collected for them. So we know it's working now, regardless of whatever happened a few months back. But we are definitely in network and participating with those plans, especially at this time.
That is so impressive to hear. First of all, let me reach out to some hardworking people. Jean Diversa in my office, constantly helping the clients. She was on the phone with big directors, like head of Medicare at Anthem. You called it Blue Cross Blue Shield, David. We have to call it Anthem under the guidelines.
Oh, fair enough. Yep.
Diane Zappone on the ground floor at Waterbury Hospital in Billing. She and Jean are family members, but they were on the phone regularly trying to make sure that the client was taken care of. So I believe the contract was officially signed in place on February 22nd. I believe, is that the date?
It could be within that range.
Yeah, okay, give or take a few days. We don't want to be quoted. This is just an assisted helping radio show. This is not a fact radio show. The facts are for Larry Rifkin. But around the week of the 22nd, the contract negotiation went through. Anthem Blue Cross Blue Shield, owned by WellPoint, W-E-L-L Point. WellPoint, the stock is WLP. It is happy to say, go to Waterbury Hospital, get your services there, get your colonoscopy done, get your one-day surgeries, get your CAT scans, MRIs, PET scans. They've got a beautiful facility at the emergency room. They are definitely accepting Anthem MediBlue, which is an HMO, as well as the LPPO that David touched on. So now, David, the reason the LPPO, which is local preferred provider option, the reason they were having some trouble with that is due to the fact that in contract negotiations, you need to honor in-network as well as out-of-network. So Anthem's easy answer was, well, if the hospital's not in-network, just deem it as out-of-network. But that's where the gray area was. You wanted to make sure the contract was signed what was better for you and Waterbury Hospital, not what was better for Anthem. Anthem has a tendency to be a big bully and come in trying to underpay the doctors what they really deserve. So the reasonable and customary rate is really what you guys were arguing about, correct?
That's correct.
Yes. So I believe we've settled on around 83.87, between $83 on every $100 billed we're going to reimburse. You're never going to get with reasonable and customary, or UCR as the industry term is, you're never going to get $100 on $100. And that, unfortunately, is life. The physicians are paid 65% with Medicaid. So if you buy an Advantage plan and it's truly a zero premium plan, it's still better for the hospital's benefit to get paid by the carrier at around 80 to low 80s. So, David, I cannot thank you enough for calling in. Thanks, Sunil. Also, Matt, who really facilitated this. I know he's on vacation, and I hope he's having a great time. Jean Russo, she was fantastic in making sure you and I hooked up. I will make sure I bend over backwards. Anytime you need me in contract negotiations, David, please don't hesitate to call me. I own GS Regan Associates. I'm on Wolcott Street. I've been doing this for 21 years. I know David Fusco, the president and CEO of Anthem. I know Mark Phillips, the president and CEO of United Healthcare. I'm in the trenches every day. I work 6 days a week. Anytime you need me, Darlene Stromstead, anything with the merger of the hospital, please don't hesitate to call me, because you've been there for me today, letting my listeners know that, yes, if you have Anthem, LPPO, or MediBlue, Waterbury Hospital's in-network. Don't shy away. Use it. It's a great facility.
I appreciate that. Thank you so much, and we look forward to your support.
I sincerely appreciate your time, David. Have a great day.
All right,
good caller. Woo! That's what I'm talking about. You hear the show. You listen to me. These contracts are not easy to get signed. So my buddy Richard Karpicki out there, I told you I would win the battle. Caller on line 2 who's been patiently waiting, Michael Regan. How can I help you?
Hi, Mike.
Yes.
When you opened the program, you said you had the answer about the
I did.
Well, please, I wasn't clear what you said.
No worries. I got it. I'm so excited. Are you the gentleman who called in about a month ago with the means test?
Yep.
All right. Hold on. Let me find the document. Tommy Graves, hold him on a second. Kimberly, you talk about the Hearth. I got to find the piece of paper.
Absolutely. Yes. And thanks to our caller from Waterbury Hospital, I'll be on my way after this. I'll be going over there to visit one of our residents who is convalescing there. That's part of my job. I do community outreach and then a little bit of patient advocacy. So good work over there at Waterbury Hospital and St. Mary's as well. Can't leave those out. I am from the Hearth at Southbury. We are a traditional assisted living community. We have 96 independent and assisted apartments and 28 memory care apartments for those with a diagnosis of Alzheimer's or dementia. That is a secured unit. In our independent and assisted living side, we have small studios, which are 310 square feet, up to 1 and 2 bedrooms. So, please give us a call if you think that assisted living might be a choice that you'd like to go. As Michael said, you don't want to wait. You want to come into assisted living and enjoy us while you are still ambulatory and able to enjoy our lifestyle of our 3 meals a day and our happy hour and all our fun social activities.
All right, so the caller who's on line 2, stay on hold. Larry Rifkin touched on it. It was actually my paper. I surfed the internet. I checked high and low. I do have the answer. It's a $10,000 means test. It's an asset means test. But I want to read the exact statement. So just stay on hold. I'll get the answer. No, it was a white piece of paper. Check with Larry Rifkin. See if you can get it on the cell phone where he put the piece of paper I gave him when he was on the air. All right, let me go on to a couple other things. I promise I will get back to you. Stay on hold, or you can just hang up and call back in a few minutes, because I do have the answer, and I'm stoked about it, too. It took me like 3 weeks to get the answer. Senator Kaine didn't know it. The Department of Social Services put out a letter stating that if someone had assets more of $10,000. So let me read it, because I didn't write it, and I can't be stating that. But let me go on. I'm going to talk about health care reform now, and I know the phones are going to light up because it happened. It happened. I don't know if it's going to be good or bad, but let me touch on some good stuff, all right? Generic Lipitor moves to Tier 1. This is important. This happens at least twice a week at the office. On June 14th, generic Lipitor moved from Tier 2 to Tier 1 on the Advantage prescription list. On June 1st, generics Lipitor's 6-month period of limited competition expired and other manufacturers entered the market. It's called atorvastatin, decreasing the generic's overall price. The generic pricing was monitored on a daily basis and reached a price low enough to be moved to the lower tier. So for you out there listening, and I know you are because you spoke up like axe grinders at my seminars. Well, I'm still paying this. I couldn't help it. December 1st, the generics were open to the market, but it did take some time in order for us to get this approved. Anthem and United Healthcare have both moved it to Tier 1, which means $2 at Target, $4 at Walmart, or if you're like me and you like to use your own pharmacy, you're going to pay most likely $7. But you're not going to pay the $44 fee anymore. Let the caller know. I'll get the means test as soon as I can, I promise. All right. So now let's talk to Kimberly. What's a basic price? Because the number one thing my listeners are doing out there is saying, well, what's this going to cost me, $20,000 a month? I mean, don't let them get carried away. This is something you need. The Hearth at Southbury is something important. If you live in the Southbury, Woodbury, Litchfield County area, as far as I've heard, people are coming from Danbury to you.
Oh, absolutely.
There's only literally no competition. There's one in Ridgefield, and there's only one in Upper Litchfield, and then you really have the whole New Haven County wrapped up. So for those of you listening in Hamden, hello, and thank you for listening. Anyone in Prospect, Beacon Falls, Cheshire, Waterbury, Middlebury, Southbury, and Woodbury, the Hearth is basically your facility. Some people, as I was doing my research during the week, said Elam Park. Elam Park didn't look like your facility at all. It looked more like a hospital. So if you can afford it, basically, where do you start with your lower priced, and then where do you go for the elite?
Sure.
Thank you.
Our studio apartments start at $39.95 per month. We are a monthly rental. We're not a buy-in, so there's no big fee to put down. Then we have one-bedroom apartments that go from $44.95 to $48.95 per month. One bedroom is plenty for a couple. I also have two bedrooms. However, I won't share the price with you because I have none of those available at the moment.
And that should be something they should be calling you directly on. Anyway.
Absolutely. And then in our memory care unit, we have something that's very unique to Hearth Management, the company that owns us, is we have an all-inclusive rate in our memory care unit, and that is $59.95 and $55.95 for a shared.
Okay. I have clients and friends. I definitely call them friends. They live on South Street in Middlebury, right behind Westover School. If you've ever driven down that street, you can tell the homes. It's one of those homes where you're like, oh, no, they live here. So they have made a mistake and have ignored me for the past 20 years when I said, you know, you really should get your parents long-term care. And their answer was, why? They've got millions. Well, they are squandering it by the month now. And if you look, you said that the lower cost, because most of my clients are tight with their money. They don't even like to part with it. So the lower cost one was $39, how much a month?
$39.95.
Okay, so that's within $5. It's $4,000 a month, $48,000 a year. That's doable. $48,000 a year. What's a life expectancy stay for your facility?
Typically, in assisted living, a senior stays with us about 3 to 5 years.
Okay. Do you hear that? 3 to 5 years. And how do you coordinate? Because when I spoke to Lance, by the way, you're much better looking, but when I spoke to Lance, he had stated that, of course, we take long-term care policies. So you check the people in. The long-term care policy is aware of the fact that they're at your facility, and they pay the client or they pay the Hearth.
You know, that's a good question, Michael, that I'm not exactly sure that I can answer because I leave that up to our business office manager. Who's,
all right.
She's the pro at
right.
that.
I have enough basic knowledge. It's my show. My name's on the building. So I can tell you the answer. There's two different choices. One is taking an at-home, 100% at-home care, and one is at the facility care. So depending on how you've arranged your long-term care policy, either Prudential, Genworth, John Hancock will either send you at $250 a day times 30 days or $300 a day times 30 days. They will send you the $7,500 or $9,000 check. You, therefore, can try to, if you can, which is extremely difficult. That's why the Hearth is here, because I've watched it happen. At $250 a day times 30, you're looking at $7,500. You've got to coordinate your food, your laundry, your custodial care. You're not getting skilled facility at home. You're going to get an agency. I must plug, because I like her a lot, Angel's watching over me, over you. I think she does a great job, Lisa. And at $300 a day for you slightly more affluent client, you're going to get a $9,000 check. So if Kimberly says, she goes by Kimberly. I like Kimberly. It's a much more woman name. At $4,000, you're going to get 2+ months out of your check. And that will hold a couple, the $4,000 room?
Yes, there is a $1,000 extra person fee.
Per month?
Correct.
All right, so what's the most affordable two-person room? The 44 or the 48?
Well, so let's say $48.95.
Okay, so $48.95.
Add additional $1,000 for the second person.
You're going to get that money, no problem, all day. And people always say, oh, it's just too expensive. I spoke to my financial planner. Your financial planner hasn't been selling insurance for 20 years. They've been watching the stock market go up and down. And I'm telling you right now, $5,000 to $8,000 a year for a married couple that are healthy with a spousal discount goes a long way. All right? So either pay the Hearth now or buy the policy and pay later. Let's move on and talk about that phenomenal thing you described where you're going next to Waterbury Hospital to check up on your people.
Actually,
wait till you hear this. Please.
I mentioned that while you were out of the room, actually.
My bad. I mean, I love that. I'm still looking for that means test, I promise you. But that really is such an added extra benefit. It's really like not a customer service even, just a pure out caring.
Absolutely. And we are all about customer service and caring. I mean, basically what it comes down to that our residents are the most important people. We know that. Our employees service them, give them great customer service because they are what makes us run. And just going back to what we were talking about before, the price-wise, I will provide you a monthly cost comparison, and you can actually break down everything and see the cost of what your food and your utilities and having someone come in to shovel that snow and cut your lawn. We do all that, and that's part of your rent. So
at the Hearth.
At the Hearth.
Now, what do the people that own their own homes? That's up to the people's children or caregivers, correct? To maintain their own home while they're away.
Correct. And, and home care agencies are wonderful, but what happens when that aide that you normally have come, she gets sick, or her children get sick, or there's a blizzard and she can't drive in the blizzard?
Right.
Then you're stuck without any care for that day. If you were at the Hearth, the care is going to be there. And
I think you guys are almost booked to capacity, correct?
We are getting there, yes. Yeah. We're hoping that by the end of fall that we will be completely booked at 100%. Yeah. We are probably about at 90% right now.
So 90% capacity. Mm-hmm. All right, we're going to take a commercial break. Producer Tom's telling me that's enough. We'll be back after we plug the sponsors.